To not exercise is more risky than to exercise. It's actually an independent risk factor for developing pregnancy complications. Like if you don't exercise, your likelihood of developing complications increase.
Welcome to the HSE Talking Health and Wellbeing podcast. I'm Eamon Keogh. Today we're continuing our series on physical activity with a focus on a group who often feel uncertain about exercise, pregnant and postpartum women. Over recent episodes, we've explored the new physical activity guidelines, Every Move Counts. In June 2025, those guidelines were extended to cover pregnant and postpartum women for the first time. We know that even small increases in moderate physical activity can significantly improve health. But when your body is going through major change and you're worried about doing anything that might harm you or your baby, it's completely understandable to feel hesitant. Here to talk through all this with me are Dr. Ailish McGrath, researcher and lecturer in the School of Health Sciences at South East Technological University, Waterford, and Ailish Cleary, HSE physiotherapist and private provider with an interest in pregnancy and exercise. You're both very welcome.
Thanks for having us, Eamon.
Not at all. So, Ailish, I might start with yourself. Just for listeners who might not be familiar with Every Move Counts, could you briefly explain how the guidelines now apply to pregnant and postpartum women?
Yeah, sure. So Every Move Counts is Ireland's national set of physical activity and sedentary behaviour guidelines. And really, it's an evidence-based roadmap for helping people of all ages understand how much movement can support health, as you said, Eamon, and why also reducing sitting time is very important too. So Every Move Counts would have been updated last year to reflect a more global shift in WHO guidelines, for example. But for the first time in Ireland now, they've been extended to include pregnant and postpartum women. And they were groups that were previously underrepresented in public health guidelines. So it's great for us to be able to do that and have that.
Very good. And what's new about these guidelines compared to what was there before?
This is the first time Ireland has pregnancy and postpartum guidelines, so it's fantastic that we have that. And there's a few things that are generally new when you're looking at it from a global perspective as well. So the WHO guidance, for example, combines the pregnancy and postpartum stage, and really our consultation, in the development of the guidelines made it clear that pregnancy and postpartum, well, they're very different experiences. So women have very different needs during those times. So we developed two standalone set of guidelines, each with its own evidence-based population statements and tailored messaging. Another thing that we were able to do as well is we added specific population statements, and this was reflective of maybe some of the newer evidence that was emerging. So that gives additional clarity for different groups of women. For example, women who might be inactive, active, are also very highly active women. So it's nice for us to be able to give that extra nuance as well in terms of the guidance. We also created separate messages for different stakeholders so that we could translate the guidelines in a more lay way as well. So for the public, so pregnant and postpartum women themselves, but also to support health and social care professionals, exercise and physical activity practitioners. And we also included messages for policy and decision makers in terms of building capacity and supporting professionals on the ground, reflecting that pregnancy and postpartum physical activity, it should be a public health priority.
Very good. And you led the development of these guidelines, didn't you? Just from what you've described there seemed to be a lot of partners or stakeholders getting involved in that. Can you talk a little bit about the process to us?
Yeah, sure. So it was chaired by Professor Michael Harrison. I would have led on the development of the pregnancy and postpartum guidelines. But in tandem with that, we were also developing guidelines for people with chronic conditions for the first time as well.
Right.
So we had a comprehensive team of national and international academics and also practitioners. Importantly, we had two international experts in maternal health and exercise physiology as well. So there was a nice group of experts with a range of different expertise in terms of exercise prescription, physical activity promotion, health promotion, and maternal health. What we did, I suppose, in terms of the development process then is we began with an evidence summary. So what we wanted to do was collate all of the existing evidence, namely things that would have emerged after the WHO guidelines were published in 2020. We would have looked at other English-speaking, mainly physical activity guidelines for pregnant and postpartum women, their evidence summaries and any key emerging evidence that would have came out since those so that we could have the best available evidence to incorporate into those. So we have a comprehensive report that's available for anyone who's interested in that as well. And I'm happy to make that available so you can read the summary of that evidence. Following that, then we had the expert working group review, where we would have looked at tailoring the messaging, tailoring the statements to capture that nuance. Then, importantly, we had a stakeholder consultation process as well, where we engaged pregnant and postpartum women. So we had over 400 pregnant and postpartum women feed into the guidelines. So they would have been able to review them for things like clarity and acceptability, how user-friendly the messaging was. We also engaged professionals in the space, so health and social care professionals, exercise professionals, physical activity professionals, so that they could give their input as well. So following that, then, Eamon, what we did was we collated all of that information and we looked at where the guidelines needed refinement based on the lived experience of women who fed into them and also the professionals. We then convened a national stakeholder meeting where we brought together professionals in the space, so academics, practitioners, advocacy, policymakers, decision makers as well. And we worked together to refine the guidelines. And lastly, then we consolidated and refined those. And you have the final output then today.
Very good. Just to talk to us a little bit about that final output, could you tell us what the guidelines actually recommend in terms of physical activity for pregnant and postpartum women?
Yeah, sure. So most importantly, we could start with saying that generally physical activity is safe and beneficial. It sometimes may require modification, but in general, we can say that the benefits would far outweigh the risks for pregnant and postpartum women. And I think that's important for us to be able to get that message out clearly. So the guidelines then would recommend, similar to the general population to start, about 2.5 hours of moderate intensity aerobic activity a week. So things like brisk walking, swimming, but also to try and incorporate some muscle strengthening exercises for pregnant women as well. Pelvic floor muscle strengthening exercises are particularly important. And Ailish, I'm sure you'll be able to come in with some of the background on that too. For postpartum women, it's similar as well. So to focus on 2.5 hours of aerobic exercise per week and trying to incorporate early on, your pelvic floor muscle exercises and incorporating muscle strengthening throughout the week as well. For both population groups, then it's around trying to limit sedentary behavior. And that's very much respectful of the need for rest and recovery. It's not always going to be a situation where during pregnancy, there's going to be things like nausea, there's going to be fatigue, and obviously during postpartum, the recovery process is so individual to each woman. And so while it's important to try and reach to meet those guidelines, the message I think is really important to get across that some movement is better than none. So even light intensity during times where you might be not feeling so well, we will try and encourage that just for benefits that you could accrue.
Okay.
And also reducing the risk of gestational diabetes, high blood pressure, improving mood, sleep, and also importantly, postnatal recovery. So the WHO's 2020 review and subsequent studies show that the benefits for when activity is performed safely and of course adapted to the woman's stage and condition. So we reviewed that evidence carefully and we aligned it with international standards. It's important to have national guidelines for your own country, because you can translate them in that Irish context then. So capturing that nuance that things are more context specific and maybe more culturally relevant. It is evidence-based and the evidence is strong to support that. Women should engage in physical activity during pregnancy and postpartum. And there are few, I suppose, contraindications that would encourage limited physical activity completely. Like modifications and adaptations may need to happen, but generally it is safe.
Okay, great. Ailish, I might come to you. You're a practicing physio working with women every day. Can I just ask your take on the guidelines really from a practical standpoint?
I'm just really, really excited that Ireland has created them. And I think they're super progressive. They're really evidence-based. It's great to have our own guidelines because I've been teaching classes since 2008. Up until now, I've been working off other guidelines like Canadian guidelines or the Australian guidelines. And to have more culturally specific guidelines is really good. And outside of that, they're just really progressive and up to date. And actually simple, easy to follow. And what's great is that they have included the messaging for different healthcare professionals as well. That's new, like that wouldn't be in the other guidelines.
Right, okay. What supports or tweaks help women actually follow them, do you think? They're easier to read, is it?
Yeah, they're just really straightforward. It's like 2.5 hours mix of aerobic and strengthening exercise. And if you haven't been active before, start, ease into it. They're very easy to follow. There's nothing complicated about them and also very, I suppose, enticing or motivating and reassuring. Reassurance is probably what most pregnant women need.
Okay. Actually, Aisling alluded to it at the start there, but when we say physical activity, what we're actually talking about, it's not about just structured classes, is it? It's about everyday movement.
Yeah, it is about everyday movements and to limit extended periods of sedentary activity as well. Because nowadays, a lot of pregnant women that I would know, they may have a commute to work. They may be sitting at a desk for long periods. But getting up and breaking up the longer periods of sedentary is part of this. But also it is nice to have like extended periods of physical activity. You're more likely to get your heart rate up. You're more likely to activate your respiratory system and all your other systems that are required for physical activity. So you have your little movement snacks that you do during the day to limit your time in sedentary time.
Yeah.
But then it is good to also have prolonged, structured exercise. Now, that doesn't have to be in a class format. That can be your walk, your swimming, whatever. That doesn't have to be a class format.
Yeah. Very good. And just to talk about for a minute, many women, I'd say, are worried or concerned about exercise or doing too much exercise that might put themselves or their baby at risk. What would you say to them?
The pregnancies that have complications are actually quite rare, in the grand scheme of like how many women get pregnant. And that's what's really nice about these guidelines. They do say it. Other guidelines in the past have talked about the complications and the pregnancies that can have complications where you may need to limit your physical activity more. They touch on it, they mention it, its importance, but the general message is for the majority of women, it is 100% safe to exercise. And my experience of teaching classes with pregnant women is that women that have the real complications, what we call the absolute contraindications, they don't present to the classes. They already know that it's not safe for them to do too much physical activity. The real absolute contraindications would be things like maybe people who have heart issues or lung issues, like they've long-standing heart or lung issues. If they've any kind of incompetent cervix, where they've had to have a stitch put in their cervix, any kind of bleeding. Another one that would come up for us would be placenta previa, where the placenta is very low lying. Like they might start with us and then it becomes obvious that the placenta is low lying and then they'll have to stop. So they'd be the kind of ones that would be a little bit more higher risk. But your normal, no major issues, it's totally 100% safe for them to exercise. To not exercise is more risky than to exercise.
Okay.
It's actually an independent risk factor for developing pregnancy complications. Like if you don't exercise, you're more likely to develop high blood pressure. You're more likely to develop gestational diabetes. Your likelihood of developing complications increase.
Yeah. And what about the fear of, can exercise harm my baby? What would you say?
There's been no studies to suggest that. There have been no studies to suggest that exercise harms the baby. If anything, actually, there have been studies on pregnant rats and things like that, where the baby rats are born with increased heart rate variability. So they actually are born with stronger hearts. The challenge with exercise in pregnancy and studies, and Aisling now being the researcher, I'm sure you probably know more than me about this, but in the past, the challenge is that you can't be pushing pregnant women on a treadmill to see, how much can we do before the baby's under pressure? That's unethical.
Yeah.
So how do we, to get optimum intensity and frequency is very difficult with this cohort of patients. But in general, there has never been any evidence to suggest that exercise damages the baby.
Right. Okay.
The only thing which is mentioned in the guidelines is obviously exercise where there's a risk of falling, like skiing, horse riding, contact sports, things where there could be a direct trauma to the abdomen.
Yeah. I get you, yeah.
Ailish is right. It's not possible to do that type of research to say indefinitely that there's no risk, but the best available evidence that we have is that the benefits far outweigh the risks and that physical activity is generally safe for most women during pregnancy and during postpartum. I think it's important just to say what Ailish said in terms of there are obviously activities that women should avoid.
Yeah.
So things that are like high contact sports, but most physical activity. And, one thing that we did with the guidelines as well was trying to balance the need to be somewhat cautious, but also to try and empower women to know that it is generally safe to be physically active. And even being able to tailor our statements to the specific populations, that if a woman is inactive prior to pregnancy, she can still get active during pregnancy. We're not saying that she should go out and run a marathon now or do anything that's very vigorous, but even light intensity, short walks, aim to build up to the guidelines of 2.5 hours of moderate intensity per week. So for the general pregnant woman, moderate intensity. So I'm talking about somewhat hard, that you're getting a little bit sweaty, you can feel your heart rate up, but you're not pushing yourself into those kind of maximal zones, of vigorous activity. But it is also important to say that active women who were habitually active, and Ailish, you can come in here as well, in terms of your experience, like prior to and during pregnancy, can stay active. They can generally maintain their activity, particularly women who were highly active as well. They should be able to stay active as long as it feels comfortable. They might need that extra little bit of support from a healthcare practitioner or professional. But it is generally safe for women to stay active if they have been habitually, and for sedentary women to get active with light intensity to start and try to build up.
Just to add to that, I've had lots of different women in my classes, and I've had women who come from a very active background, women who've done Ironman, things like that, and they can keep going, running until 30 weeks. I had one woman who used to run 5 kilometers to my class, do my class, run 5 kilometers home. And she was able to do that until 30 weeks, But that's what her body has been conditioned and used to doing for many, many years, so the thing about these guidelines is, I say frequently to the women, is that every woman is different, every background is different, their physical fitness and tolerance is different, and it's their ability to be able to tune in to their bodies during this time and trust themselves and listen to their bodies about what they feel they can and cannot do. Because my experience of pregnancy is that women are very intuitive, very connected to their bodies, and they instinctively know what feels right and what doesn't feel so right. And I'm just constantly encouraging that kind of sense of intuition and trust their intuition around things. Because at the end of the day, they're living in their body's going through this massive transformation in a very short period of time. And they know more than I do even about what they're capable of doing. And frequently they would say to me, the ones that are very active would say things like, oh, I stopped running at around 28 weeks. It just stopped feeling comfortable. I didn't like it anymore. They know already where the limits are.
Yeah.
For me, that's kind of the biggest thing, which is great about these guidelines as well. It's really encouraging that trust in each woman's intuitive sense of where their capabilities are. Yeah, that's pretty big for me, because I often would have women as well that do CrossFit, high rocks, those kind of high intensity loading activities. And experience with those women is they do tend to have to pull back a little bit earlier than the aerobic people, because all those plyometric jumping activities can be quite intense or uncomfortable on the pelvic floor and on the pelvis. But women will get it. They'll know. It's getting them to be really attuned to that is the main thing.
Yeah. Traditionally, women were told to rest, weren't they, and take it easy. So this is a real shift in thinking.
Yeah, or not take up anything new.
Yeah.
That was another thing was don't take up anything new. Don't start anything new. That was kind of the main thing they would hear. And I would say they still possibly hear is not to start anything new. And that's totally not the right advice. If you have someone that's very sedentary, you'd be highly encouraging them to start taking up some physical activity.
Just to come in there, this is a really important thing that we're touching on here, in terms of the norms, things that still exist today, in terms of belief around pregnancy. I remember being pregnant myself and everyone thought, oh, we'll have to wrap up and bubble wrap now.
Yeah.
You have to be minded, you have to rest. It's all about bed rest. But actually, in reality, what I've already said is the benefits outweigh the risks, in terms of your mental health, how quickly you recover after pregnancy if you've tried to maintain some level of physical activity, in terms of gestational weight gain and gestational diabetes, in terms of limiting risks, so that the activity is so important. It's really important that we do work hard to dispel those myths.
Yeah.
So that women feel like it's safe, because I think one of the biggest barriers to physical activity in pregnancy and postpartum is fear. It's just that, it's not really being communicated very well. The healthcare professional is so important here in terms of being that credible source. So starting those conversations early and dispelling those myths around physical activity is really key to translating these guidelines.
Yeah, you did speak to a lot of pregnant women, as you said, as part of the development of the guidelines. But I'm just interested now, did that come up when you were talking to them in terms of that traditional take it easy when you presented the guidelines or you went through it? What was their take on it?
I think what came out really strongly is that fear does still very much exist, particularly if women have had complications, and, they spoke about not wanting to feel judged or stigmatized either. for not being physically active. And, just to go back to what I said early on, that this is what we recommend. But of course, each woman's experience is so different. And if you're feeling unwell and you're feeling fatigued, it's not that these guidelines are in any way meant to be preachy that, oh, well, you shouldn't be sitting down or you shouldn't be resting too much. It's just about trying to do what you can, because some activity is better than none. Even if you can't undertake those 2.5 hours, try and build up to do something just to get your body moving so that you can feel some way better,
Yeah. And Ailish, just from your experience in, I suppose, meeting women every day and the classes you teach, would you find that uneasiness or that?
I wouldn't, because I suppose they're there in my classes, so they've already kind of bought into the process.
Yeah.
But what is interesting though, because we do ask in our screening questionnaire, what concerns or worries do they have? And actually, fear of childbirth is the most common one for us. And I know this is a bit anecdotal, but is that women who do exercise in pregnancy tend to have less complicated births. But that's not a given, because I've also had women who've done everything right, been active, and then had every intervention under the sun afterwards,
Yeah.
But my experience is that the fitter you are, what I say to women is like pregnancy is like an endurance event. It is literally like an endurance event, and you must prepare your body for it. And the birth is the marathon. That is the final end. And the more active you are, the fitter you are going into it, the more likely you're going to get through it easier. But it's the postnatal recovery, like what Aisling said, that's where I would see the real benefits. They've invested, they've banked all this into their body, and then their body goes through this massive event, this massive endurance event and this birth, and then they have to heal afterwards. And the women that have kept active tend to come out of that process a little bit more powerful. They just tend to heal quicker because they can get going quicker, they can move quicker. So I don't see fear of exercise with the women that come to me. I would say that a lot of women who've had a very difficult, challenging journey to pregnancy, maybe they've had assisted conception, those women are definitely a little bit more anxious, I would say, than fearful. They're just anxious in general. So those women I tend to kind of mind a little bit more. What really helps them is where they see another person in the class that's 1 week to go or 2 weeks to go, and they're doing absolutely everything. So that can be very inspiring.
Yeah, when we were looking at the evidence summaries, there was evidence to show that the benefits do extend to that in terms of trials and systematic reviews that would say that moderate, regular physical activity, particularly though in an uncomplicated pregnancy, as Ailish said, is associated with a higher likelihood of things like maybe having a more spontaneous vaginal birth or slightly reduced risk of cesarean section, or maybe even shorter labour. So if you're also, I think it's important when we have this in the guidelines that pregnant women, I think sometimes they think that the pelvic floor muscle training should start in postpartum, but actually in pregnancy is where it's important too, because you want to be able to have that asset, going into your labour as well. And in terms of your pelvic floor recovery, and Ailish, you might be able to speak to that in terms of your experience as well.
Yeah, and I think there's also just a piece around body awareness. When you're kind of moving and you're connected with your body physically, you're more likely to be connected with it during the birth as well. Because the birth is such a physical process. It's at many levels, it's obviously pelvic floor, but also just this ability to move your body and be more supple. Because you've stayed mobile, you're going to be able to move more during the pregnancy, which in itself can help the pelvic outlet open, can progress the labour a little bit quicker. You have some kind of endurance. You're less likely to fatigue as quick. I would agree. I would say that having spoken to women in my classes and talking to them afterwards about how the birth goes, that there definitely is better outcomes if you're physically active. But birth is, an inherently tricky process. It has inherent risks, irrespective of if you did everything right.
Exactly.
But I do think it is a big benefit that maybe we don't talk about too much, but it is.
I think what you were saying there as well, just about listening to your body when you're exercising as well, just to make sure you're doing it in a safe and a way that suits you.
Yeah.
Ailish, just to talk about pelvic floor work, how do you tailor that?
The pelvic floor work is important in the classes. It's not my main focus because I know that every time someone exercises, every time they do a lunge, a squat, when we do our aerobics, that their pelvic floor is working. Their pelvic floor works all the time. It works in tandem with your diaphragm. Every time you breathe, your pelvic floor works. How we tend to work on it in the class is we first of all kind of bring awareness to that piece. how your pelvic floor works in tandem with all your other muscles and your diaphragm. And we do that through breath work and also just through exercises. And then we also talk about the importance of, like, say, toilet positioning, protecting your pelvic floor whenever you have a bowel movement. That's something we talk about. And constipation as well can have a big impact on the pelvic floor. We talk about tips for that. And then we do the pelvic floor exercises within the class, but like I would only spend 5-10 minutes educating women about it, because I think sometimes women feel guilty that they're not doing enough pelvic floor exercises, right? There can be that kind of element to it. So I want to reassure them that, like, look, don't worry, because every time you move, your pelvic floor is working. But if you want to get the bonus points, you can do your pelvic floor exercises as well. But where they're really important really is in the postpartum period. But if you kind of plant the seed pregnancy, it's more likely to follow through postnatally.
Okay. And can I just ask, just for women who currently are inactive and not sure how to get started, what could they do this week?
I mean, that's a great question. Like walking is the obvious one. And even just breaking it up into like little blocks, like 5-minute blocks, 10-minute blocks, not to go too hard, just breaking it up into small pieces. A lot of it could be something like parking your car further away from where you normally would park it, when you're doing your shopping or when you're taking the stairs instead of the lift. Just kind of making more movement choices, trying to introduce movement into your day. So looking at your day and wondering, where can I have a little bit more movement? And then just acknowledging yourself for that first. That's where I'd start first. Setting little timers on your watch or on your computer to get up and move. Because like there is a lot of movements within our day. And then there's lots of movements that have kind of been stolen from us without us even realizing. Now, I'm also guilty of parking the car very close to my door at work. But I see my physio colleagues always park really far away and then I feel guilty. But like I find that like it's not that women want to be sedentary or women that are sedentary. I often find the barriers are more finding the time, carving out the time for themselves. My experience is that women are so busy caring for other children or caring for their spouses or caring for partners or caring for parents or doing all this caregiving work, as well as maybe their paid work, that they just are so tired that they find it really difficult to carve out the time. And the irony is like, obviously if you could carve out the time and you exercised a bit, you wouldn't be as tired. That's kind of the irony of it. But I know that women want to be more active. The hardest thing is giving themselves permission to actually prioritize themselves once a day.
Right. Okay. And can I ask then, just in terms of resources available or things available to women to help them on their exercise journey or to keep exercising? There's a lot of good resources across the HSE, really, isn't there?
Yeah, like the HSE have really good exercise videos, but I really like the Rotunda. The Rotunda have lovely exercise videos, breathing videos, birth videos. There's excellent resources. It's a UK website. It's called Active Pregnancy, and they have little booklets for each type of exercise. So if you're a person that used to cycle, used to run, used to box, used to swim, used to walk, used to hike, used to whatever, they have a booklet for each one. So that's really helpful as well. And then like most areas do have local classes running for pregnant women. So it's really just looking out for that, maybe getting some recommendations, like the ones that are running, the public health nurses would know, the GPs would know, the practice nurses would know, the midwives in the hospital would know, the ones that are running a long time and that are credible and have a good reputation. So usually word of mouth is the strongest indicator.
Yeah, that covers a lot of them. We're talking about physical activity today, but just to signpost as well, or to point towards yourmentalhealth.ie has a lot of good resources as well in terms of just if someone's feeling anxious. We've launched a program recently called Balancing Stress. So that's available there as well. It's just a number of videos. So I suppose mental health as well is just as important as physical health, isn't it?
Yeah, and thankfully now a lot of the hospitals have the perinatal support teams. So if a woman is struggling, they can be referred to the perinatal team.
Yeah.
And quite often there are counsellors as well that are experts in the area of pregnancy loss, postnatal. The resources are out there. It's just having conversations with your healthcare provider and they'll be able to signpost you.
Yeah. And Aisling, just coming back to you, I'm just conscious we have a lot of healthcare professionals that listen and tune into this podcast, but thinking about healthcare professionals who are working with women during and after pregnancy, what needs to change in terms of training for them or messaging so they're comfortable in supporting women to continue to move and be active?
Yeah, that's a big question. Even there's a lot in that. We tried to tailor the messages for the healthcare professionals as well. So the physical activity, the exercise professionals, health and social care, to try and give them some more guidance in terms of how to communicate those messages effectively that are in the guidelines for pregnant and postpartum women. But there is a lot that needs to happen. And I think the fact that as a result of the consultation process, we developed policy and decision maker messages kind of off the back of that, because it was highlighting there's some excellent practitioners out there, but they are limited too. So, how much can you actually signpost a pregnant woman if the capacity isn't there? So really it's around, highlighting that it is a public health priority and that we should be embedding physical activity into antenatal care from the start, and whether that's training and upskilling, a level of that will need to happen. But just even healthcare professionals recognizing they are the best place. Like the evidence shows that when professionals have a conversation around physical activity, they're viewed as a credible source. So it's raising that awareness. And when we talk about physical activity promotion for the general population, there's a lot of advocacy around ensuring that that actually becomes a vital sign. When you're asked in a GP practice, for example, things like blood pressure, or even for pregnant women talking about folic acid or smoking cessation, that physical activity should be a conversation that happens as well. So emphasizing the benefits, I suppose, and I hope that the guidelines will help with that kind of clear, consistent messaging for practitioners in that space, and that it kind of maybe takes some of the fear out of it for them as well, because there is a lack of confidence that can go with trying to have those conversations when the guidance isn't there. So hopefully that's been rectified somewhat as well. But just to recognize that they are best placed credible sources and not to underestimate how much they can empower women to be physically active and to dispel those myths that we talked about earlier, to nip those in the bud quite early on.
Yeah, okay. And to signpost to the different resources that we've given there as well, I suppose.
Absolutely.
Yeah. Okay. So, Ailish, what would you say directly to a woman listening who's pregnant or postpartum and maybe unsure about whether to start moving more? Would you have any advice?
Yeah, the evidence is so strong now. And now that we have these guidelines, we know that for majority of women, it's 100% safe to start exercising. And you can do that in any form. It can be introducing just more general physical activity in your day, like we were talking about there, parking further away, taking the stairs, doing more vigorous housework. I think it works really well if you kind of have a structure in place, like maybe having a buddy that can be there to support you, to go for a walk with, or you go swimming with, or someone that has your back and you have time with them. So you have that kind of social connection. Because we know now that people are more likely to have better health outcomes and to interact more with physical activity if there's a social interaction with it. So that can be a friend or a buddy.
Yeah.
You can do it through classes as well. You can have your classes, but you can also, there's online classes as well that are free. What's great about these guidelines is it kind of gives women confidence now. It is okay, it is safe to exercise in pregnancy, and it kind of dispels the myths within society. So if anyone is questioning, are you doing too much? Should you be exercising now in your condition? Those kind of comments, we have the guidelines to say, actually, I'm meant to be doing this. This is what's good for me and good for the baby, and it's going to help me have a better pregnancy and possibly a better birth.
Yeah.
So the evidence is overwhelming. Certainly, I would say, having taught classes for years and years and having had 3 kids, it's such an important time to be active because your body is undergoing such huge changes. Like, apart from the fact that you're growing a human being, you're also growing a whole new organ in the placenta.
Yeah.
And massive changes in all your systems, like your musculoskeletal system, all your joints and tendons and ligaments undergo massive changes, as well as your cardiovascular system, like your blood volume increases by 50%. It's huge. Like, you'll never have such a massive physical transformation in such a short period of time. So the importance of movement and exercise to bed down those changes and for those changes to be embraced by your body is important. It's so critical, actually. It's just critical.
Yeah, and that's a really good point. Aisling, did you want to come back in there?
I suppose to reiterate that the guidelines are for everyone, that it's inclusive of all women, and regardless of whether you do structured exercise or even just some movement is better than none, during pregnancy and also in postpartum because of all the benefits that Ailish has alluded to there. So I just think, there's something in it for every woman, and hopefully it will support women to become more physically active, and also the healthcare professionals that are communicating those messages to the women.
Very good. Okay. And finally, Ailish, just ask the key warning signs to watch for that mean stop and check in with your doctor. Do you want to flag any of those?
I can flag the most common ones. Persistent calf pain, that could be a clot, that can kind of come on quite quickly. Another thing we would see is high blood pressure. So women would develop headaches, double vision, swelling of the hands, the feet, the face. That would be a common one as well. And then low iron, like really bad fatigue. You can see that in the women, like they just come in really pale. They develop severe anemia. So they'd be the big things to watch out for. Swelling of hands, face, feet. Headaches as well, like a sudden onset of headaches, migraines. Again, that could be a sign of a little bit of high blood pressure. The obvious ones are bleeding. People will go in immediately if they see any bleeding, but the swelling, not so much. They may not click that that's actually could be related to a blood pressure issue.
Yeah. In terms of physical activity, just to finish, is there any green flags that tell us that this level is right for me?
Yeah, you feel energized. The goal is always that they feel energized and relaxed and confident in their bodies.
Yeah.
That's what keeps us all exercising, really, isn't it? Like, that's the green flag for everyone. Why do we all do it? Because afterwards you feel much better.
Yeah.
You may not feel great during the exercise, as in like you may find it like tough going,
Yeah.
You want to get your heart rate up. You want to get the lungs working. You want to get your breathing rate up, in order to get the real benefits of exercise. Then there's also the mobility, what I call the restorative exercise, the stretching, the strength, the slow strengthening. Yeah, the green flags really are that you feel good and you generally sleep better and your mood is better.
Yeah. So all very positive.
Yeah.
Very good. Okay. Thank you for that. I'd like to thank Dr. Aisling McGrath and Ailish Cleary for joining me today. And a big thanks to all our listeners for your continued support, and please share this episode. If you would like more information about HSE Health and Wellbeing, follow us on X, take a look at our HSE Health and Wellbeing YouTube channel, or register for our Ezine by emailing healthandwellbeing.communications@hse.ie. This has been the HSE Talking Health and Wellbeing podcast. Thank you for listening.